Assalamu alaikum. Dr. Inam again here. Today I will discuss a interesting case for me. It rarely happens in ordinary doctor's life. I was in duty in King Khalid Hospital in the morning hours. There was one ambulance coming with full blowing sirens, and Saudi uh, young man about in early 20s was brought to the emergency, to the shock room. I was there. I received the patient. It was a very handsome looking boy of 20s, in 20s, 22, 23 maybe. Uh, there was no history available. I just saw that he was not breathing. There were no respiratory efforts. I checked the carotids. There were no carotids. He was full of blood, clot everywhere, in the scalp, on the face, and lower down also. And no fresh blood was coming out. I thought maybe this is a road traffic accident, because there the road traffic accidents are very, very severe sort of accidents. So anyway, I just when I didn't feel the carotids, nurses were there with me, some Filipino. I told them to put on monitor and started compression of the chest. And in the meantime, within 2, 3, 4 seconds, they put the monitor. Monitor showed a straight line. I didn't check the pupils because the body was still warm. So I started cardiac compressions quite rapidly, and within 20 to 30 seconds, his heart came back. I could see the cardiac rhythm on the monitor, and a little while later, I could feel the pulses in the precordium. I told the sisters, please you take the blood for cross matching and ask for 2 or 3 pints of blood and put 2 plasmas on in the IV line, because they could get the IV line when the pressure was a little bit recordable on the lower side. So we started. Then I started looking what is the problem. In the meantime, there was a very nice Filipino guy. He was well trained. We call him Dani. His name was Danilo. I told him that, can you put the tube in? He said yes. So we put the tube on. I was on the patient, and heart came back, but still he was not. There was no breathing effort. But with the tube in, we started giving umbo bag breathing, and I looked for. I thought maybe there are multiple injuries somewhere. I removed the clots from his scalp, and there was nothing there. No gaping wound, nothing. I was surprised. I thought there was some serious head injury or something. Then I came to the chest. I pressed the chest from the both sides. It was compliant. There was no breakage, or sometimes patient with these sort of accidents, they came with flail chest. You can even compress the chest between your hands, but it was not there. Then I went for the abdomen. Then abdomen was also soft. I was surprised, my goodness, so much blood. And he came with the cardiac standstill, and no bleeding was there active. Already bleeding has stopped. What happened? Then he was in vest, white vest with the khaki brownish uniform, shorts was there. So I asked that there was a soldier standing there. I thought, what is this? What is this? Then I noticed just below the vest there was a small gauze here in about the upper sternum of the chest. I removed that gauze. There was not a gaping wound, just as if somebody has abrased the skin and it has again come to the place. I looked at that gentleman. I said, what is this? Is gunshot? He said, yes, it's gunshot. I was surprised. My goodness, at this place with gunshot, I immediately turned that young man to on the lateral side and saw whether there was exit or not. It was not. There was no exit wound. So I was surprised. Here, all vital structures, aortic arch, and all these things, your trachea, then the esophagus, and these things. This bullet, which must be a service revolver, reputed bore for ordinary people, but very strong. But it was because they told me later on, the two of these friends, they were very good friends. They were sitting just across a small table, and there was a revolver or pistol. I'm not sure what was that, but he said, should I shoot you? The other man, yes, shoot. So his friend, he thought this bullet, there is no bullet in there, but one bullet was engaged in the barrel. This usually happens. So it's a blunder. Many times this has happened. He shot, just point blank range, and it struck him in the sternum. He fell back, and then you see very serious injury, gunshot injury. He was brought, resuscitated, and then he was admitted. They did his X-rays. They could find that the bullet has penetrated and hit the spinal cord and broke into 3 pieces. You see, this went across right from the trachea, esophagus, posterior mediastinum, and broke the vertebra and also transected the cord. This is very gross injury. I called the surgeons. They came, took him inside, kept in the ward, but they didn't do anything. The people, his parents were a little well off. They were complaining that why you are not operating. The neurosurgeons were saying that this is a very dangerous place. We cannot go in there. It may cause more harm than advantage. But they were not satisfied. They complained to Imara. That is the governor's house and the administrator. So they asked for Medivac. In those days, Medivacs were coming from the tertiary care centers like Riyadh. In 3 or 4 days' time, they shifted him to Riyadh. By that time, he was listless, not moving all 4 limbs, but in the ward with steroids, and they wanted to reduce edema around the bullet and cord. His upper limbs came because the level was here, right in the upper sternum. How this escaped, the arch of aorta and other vital things, only God knows. It was lucky in that sense that they didn't perforate the heart or the great vessels. So he was struggling a bit, then he settled down, and upper arm function came back. So he was even in the ward in Hyle. He was sitting up, and he wrote that friend of his is very good friend. It is not its fault, because I was also thinking this is empty, and he also thought this is empty, the gun. But it went through his chest. He was kept there in Riyadh for some time. Then I was told that they were not satisfied. They took him to United States of America, where he was hospitalized and looked after by the finest surgeons of that time. And they also didn't do anything, because they said this is not a place where you fiddle with. So ultimately I was told that after 3-4 months, he came back. So this is very surprising. You never see such thing right in the sternum. He got a gunshot and escaped. His vessels were saved narrowly by that bullet. So we normally, once we do these things, we do not advertise. We do not ask for any praise or something. We just finish our duty, went back. About 1.5 years later, I was in the emergency same time. A very handsome looking Saudi gentleman came on a mechanized wheelchair with his father. They came to me. They said he has sukna, means he had high-grade fever with sore throat. I just examined. There was really high-grade fever around 103 or 104, and he had upper respiratory infection. I examined. I was writing treatment. Then I asked the father, "What is the problem? Why this gentleman is on wheelchair? Automated wheelchair. He could drive around with quite speed." He said, "Doctor, don't ask. It's a long story." I thought maybe this is the same, because I could not, 1.5 years had passed, I could not remember the face at that time with full of blood. So I just said noted, and then I opened his thobe, the white shirt they are wearing. I opened the second and third button, and I looked at the sternum. In the meantime, father was asking, "Doctor, what are you doing?" I said, no, it doesn't matter. I just looked, and then I find a scar here in the sternum. I remember, oh my goodness, this is the same boy. So just I closed the buttons, and again, the patient was looking at me intently, but the father asked me, "Why you do this thing?" I said, "Just I wanted to look." So, but I didn't tell him that I was the one who resuscitated him. I was the one who put him, treated him, and called the surgeons. They took him over, because we don't want publicity on this thing. So this is very, very interesting case, and it rarely happens, especially in a cardiologist's life. I have told you earlier too, Saudi children, they must be happily living somewhere, and this gentleman may also be living somewhere. I hope so, because you cannot predict anything for the future. So I wish them healthy life in the rest of their lives, and I thought I must share this very interesting case with you. You keep on watching because I am trying that these are the things which normally ordinary doctor doesn't see them. So please keep watching and spread this, because you should not just hands up like this, that oh, this is cardiac arrest and say gunshot, so much blood around, and then still you see the guy is living, inshallah. So take care and pray for us, and I am praying for you all also, inshallah. Allah Hafiz. Assalamu alaikum.